Good job.
Just to be sure, can everyone see my screen right now?
Yes, yes, go ahead.
So good evening, everyone. I'd like to thank you all for your virtual presence here, and thank especially Dr. Shaffi and the Lions Club for the opportunity to talk about diabetes awareness. You may be asking yourselves, an orthopedic surgeon talking about diabetes. Let me briefly share my link with diabetes here. As an orthopedic surgeon working at a level 1 trauma center in one of the largest universities in South America, I've treated many diabetic patients at the final stage of the disease. I used to perform what we call damage control. It basically means performing amputations to try to preserve the life of the patient with septicemia. And back then, I was asking myself almost every day, why don't patients take care of themselves? What's going on? And I knew that understanding the patient's perspective is a key factor to treatment adherence. That's actually when I started to understand that the confusion and the low adherence to treatment wasn't the patient's fault only. Understanding the dimension of diabetes, its complexity, the multifactorial cause, and the systemic approach that it's needed, it's very overwhelming and hard to understand. We're talking about a disease that is accountable for 30% of strokes, 40% of heart attacks, 50% of kidney failure, and 70% of non-traumatic amputations. That's Canada's statistics. And unfortunately, it's not a problem that it's happening only here in Canada. It's a worldwide problem. Diabetes prevalence has been rising more rapidly in low and middle income countries than in high income countries, but actually is increasing everywhere. According to the World Health Organization, the number of people with diabetes rose from over 100 million back in the 80s to over 400 million today. There's a number here that we need to pay attention. 50%, almost 50% of the patients that are suffering from diabetes, they don't have the diagnosis. So half of the population, they don't know they are going through and what they're going through. I'd like to thank the Canadian Diabetes Association for this amazing chart. I think it's self-explanatory, but I want to emphasize one thing. 1 in 3 Canadians, they are living with diabetes or pre-diabetes. And the cost, it's over $14 billion per year, and it's raising. The knowledge of risk and complications of diabetes remains low. Less than 50% can identify less than half of the early warning signs of diabetes. Only 33% are aware that stroke might be a complication of diabetes. And only 40% of Canadians identify that heart disease might be a complication of diabetes. So we need to work with it. During these unprecedented times, it's important to emphasize the correlation between some underlying health conditions in patients with COVID-19 infection and its outcome. There are many medical papers demonstrating that diabetic patients are under a higher risk of complications and mortality compared to patients with no comorbidities. With the dimensions of the problem in mind now, let me dig a little bit on the definition and subtypes. In a nutshell, diabetes is the name of the condition where blood sugar levels consistently runs high. It's the most common endocrine disorder. The next presenter, Dr. Christine, will dig deeper in anatomy and physiology. I'm just going to scratch the surface here. To be alive, we need energy. That means food. And if we think like we are a colony of cells, every individual is a colony of cells working in harmony, we need to feed each of the cells, and the food is glucose. But the food needs to enter the cell, and to enter the cell, it needs a hormone made by the pancreas called insulin. So it's like insulin is the key, and the key lock is the receptor. So we need a key insulin working, we need the receptor working properly, and we need glucose. It's like when you have diabetes, it's like starving without having food around you. Diabetes is divided into two major subgroups. This division is based upon whether the blood sugar problem is caused by insulin deficiency or insulin resistance. Type 1 diabetes, juvenile diabetes, or insulin-dependent diabetes, it was called like that. It's when people don't produce insulin. It's like not having the key. It's different than diabetes type 2, because in diabetes type 2, actually the key is not working properly, or the key does not fit the door lock. When we think about statistics regarding how many patients have diabetes type 1 or type 2, 90% of the patients, they are under here. And the key word for type 2 diabetes is prevention. This diabetes is preventable. I'm gonna talk a little bit about the cost of diabetes. The treatment in 2017 was estimated in over $200 billion. And the investment in research is around $1 billion per year. So it's very costly. The gestational diabetes, it's another condition that we must talk about. It's basically a condition where the pregnant women experience elevated level of glucose in the blood during pregnancy, and it's self-limited. It means that it solves after the birth. But if not treated properly, it can cause excessive birth at weight, and a surgical procedure called C-section will be needed, and all the consequences of it. They can have preterm babies, premature babies, and stillbirth can happen. And babies that, which mothers they had diabetes, they have more chances to become obese or have diabetes type 2. And mothers, they also later on, they can be diabetic. The problem with the symptoms is that they are not very specific, and it's hard to understand it. It takes, there are some studies showing that when the imbalance of the metabolism starts to the diagnosis or the first symptoms show up, it takes around 10 years. So the patient will usually be 10 years asymptomatic and not knowing that they have diabetes, and it's already happening there. They feel tired, they go urinate a lot, they are always hungry. And Christine will talk a little bit more about it. She will explain each one of the symptoms. I just heard right now one thing that it's very usual. Usually the patients, they discover that they are suffering from diabetes when they go with a specific situation. Like, I have a blurry vision, I'm around 50, and I need glasses. It's normal, I'm getting older, I need glasses. And they go visit a optometrist and they will say, hey, actually you have diabetes. Orthopedic surgeons experience the same thing. The patient comes with a numb extremity or a wound that will not close. And the patient comes thinking that it's a isolated problem, and you must explain that it's just the tip of the iceberg. A condition that we must pay attention is pre-diabetes. You don't get diabetes from one day to the other. It's a chronic disease and it's insidious. It takes a long time. So when your metabolism it's working properly and you become diabetic, between those two periods, you will be pre-diabetic. And that's the best period for you to work on prevention. 9 out of 10 people with prediabetes, don't know they have it. And there are many risk factors associated with prediabetes, like overweight and hypertension. And sometimes when the patient knows that prediabetes is happening, they get like a wake-up call and they can change the outcome. The blood test to diagnose diabetes is very accessible. Every pharmacy has at least one model for sale. It's not very expensive. And the normal value ranges may vary slightly between laboratories. I'm going to talk about a personal experience that I had back in med school. A professor once said a very insightful story about lab tests, and that made me understand it better. It's like, I'm going to tell you that you won the lottery. You're going to be very happy, and I'm going to take a picture of you. You're going to smile. And a few moments later, someone brings some bad news, and the person will be sad, and they will say, hey, I'm sad now. I'm going to say, no, 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 you're not sad. I have a picture of you smiling from today. So lab tests, actually, they are a picture of a moment of your metabolism. What I want to say here, when you're fasting over 8-10 hours, it's expected for your blood to be under 100, your blood glucose be under 100. And that's considered normal. But if you are 98, 95, 99, it might be a wake-up call that you're getting closer to 100. So if you are someone that are not having the best healthy behavior, like not eating properly, is obese, I think it's the best moment for you to start changing your destiny and changing your habits to avoid getting into the pre-diabetic zone. I've been there many times. This picture here, it shows the moment that you need to inform the patient that they have diabetes. The first facial expressions could clearly express concern, and they feel overwhelmed and they don't know what to do. And it's fair, because actually it's not simply telling the patient like take the pills or take the insulin, change your diet, and go exercise. It's way more than that. You need to change sometimes the behavior. Some people around that patient might be enabling that behavior. If they have friends that only eat pizza and play video games all day, and you say, hey, go work and go eat better, probably they won't change that easy. That's why it's important to understand the multidisciplinary treatment. That's the only way to take the patient to the right place and make the best outcome for the treatment. We need lots of professionals around the patient showing different facets, different perspectives for the treatment. And it's amazing that most patients, they cannot access those professionals. They usually treat it in a simple way. Well, the takeaways from my presentation is, remember that diabetes usually stays silent for years. Diabetes is overwhelming and challenging. However, understanding the dimension of diabetes is important to treat it properly in all different aspects. We have two options here. The first option is go for treatment and face the consequence and try to control the consequence. And the other way is prevention. I think routine checkup with health professionals is the key to anticipate debilitating complications and consequences of diabetes. Prevention is the best way to go. There goes my email. Please hit me with questions or PDF stats that I've presented here. As my 5-year-old daughter always says, sharing is caring. So I believe that together we know more, so we can do more. And quoting Dr. Shafee, together we're stronger. Thank you.
Thank you.